Your chronic pain is all in your head. That is one of the most invalidating things that you can hear when you're dealing with constant pain every waking moment of the day. And it creates a lot of conflicts between patients and doctors, leading to breakdowns in trust that make it harder for doctors to provide care and harder for patients to receive it in a meaningful and healing way. The first thing we need to talk about when thinking about this is that all pain is in your head, but not all of the pain is in your head. What I mean by that is there is a peripheral nociceptive element, so there's something in your body that is generating pain signals, but all of the interpretation is in the brain. The problem is the pain itself doesn't tell the whole story, and when we reduce the conversation to just a pain score, it can be really invalidating and unhelpful. Where did the pain come from? What does the pain mean to you? What does it impair you from doing? What other functions does the pain and your experience of pain have in your social relationships and your view of yourself? When you realize how extensive and pervasive the issues caused by chronic pain are, you realize that it's not all about the pain itself. So when we have a conversation that is only about the physical sensation of pain, we are missing a lot of what a person is going through, and that can feel really, really invalidating. What I try to do instead with my patients is have that broader conversation. Because if I want somebody to feel heard, the first thing I have to do is listen, not only to their chief complaint, but to the broader context of how they experience it. And honestly, I don't think I'm the only physician who thinks this way. Problems come in when we each bring different baggages into the room. Remember, doctors are just people. So when a patient comes in at 4:30 p.m. at the end of their long workday, stressed by everything else, including the chronic pain and the chief complaint they have, and a doctor comes in exhausted because they're burdened by paperwork and 38 other things and something that's going on at home, and they meet together for a brief 15-minute visit that has no chances of allowing them, either of them, to fully canvas all of the things they hope to talk about, it's really easy for doctors and patients to miss each other. And it's kind of tragic because both of them came in really wanting to connect and have a productive, meaningful, healing relationship. But I feel hopeful because I've seen treatment relationships where that relationship is formed, where that healing space is created. Treatment plans that address a person's pain and use medications to whatever extent is necessary in that particular case, but also address the existential suffering, the functional impairment, and the identity disturbance that's created by carrying a weight of chronic pain day in and day out. I've been learning so much from all of your comments on your experiences with psychosis, and I would love to continue this conversation with you about chronic pain. If you go through it, or you've been through it, or you know someone who's been through it, and you have ideas about how to show up as a doctor in the room in a way that is meaningful and helpful to patients suffering with chronic pain, please share your thoughts. I look forward to learning from you and continuing this conversation in the comments.